ahead. I'm Amy. I'm going to be your nurse for today. I'm just kind of doing rounds. And I want to come in and check on you because I know you had surgery earlier this morning. And I was just looking on your chart and I saw that you had an open appendectomy, which is just the removal of your appendix. So I just want to come in and see how you're doing. How you feel?
A little groggy.
Okay, so that's expected from coming out of your anesthesia. How's your pain level right now?
It's about like.
Because I did see you got some pain meds about 2 hours ago.
Yeah, mild, moderate pain.
Okay, so it's a little bit more manageable?
Yes.
Okay, let me go ahead and check it out. Let me wash my hands real quick. I'm going to go ahead and check your incision. Can you go ahead and say your name band real quick? Can you go ahead and state your name for me, please?
Jeanette Sevilla.
And your date of birth?
8/21/1980.
Perfect. So I'm going to go ahead and just elevate the bed real quick. Looking at the wound right now, I see it looks pretty good. They stapled you up really well, so nothing is open. I don't see any severe redness, so wound healing process is ideal right now. So that's exactly what we want to see. I don't see any leakage coming out. Basically, the way that it is right now, as you see it, is how I want it to stay.
Okay.
So things to be concerned about, things that I want you to look out for is if anything opens up larger than what it is now. If you have any fluid leaking out, I want to know about that, especially if it's going through the actual dressing. If you smell any odor, I want to know about that as well. Any itching, any more inflammation. It's going to be tender right now, so if you do touch it, obviously it's going to be painful, but anything too severe, I need to know about that. So I can go ahead and assess it and then let the doctor know if needed, if we need to send you back into surgery for whatever reason, okay?
Okay.
But it does look good right now. So, excellent. Let me go ahead and further assess your belly. So looking at it, I see color is evenly distributed. I don't see any rashes, any other open lesions other than the one from your surgery. So I'm going to go ahead and take a listen. And you said your pain level right now on the numerical scale from 1 to 10 was a 4?
I didn't.
What is your pain level?
From 0 to 10?
From 0 to 10. 0 being mild to nothing, 10 being the most severe.
Yeah, I'd say it's a 4.
It's a 4, and that's because with the pain medication?
Yeah.
Okay, what's your tolerable level?
I told the other nurse 7.
A 7? Okay, and with that pain, you said it was pretty much localized?
Yeah, still by my incision.
Okay, is it a throbbing pain, a stabbing pain?
It was like a stabbing, constant pain.
Okay, and right now it's very minimal?
It's minimal, yeah.
Okay, so it's not radiating out anywhere. Okay, let me go ahead and take him to a listen. So I don't hear a lot of bowel sounds, which I'm not too concerned about since you are coming out of surgery and out of the anesthesia. The only thing is, my goal for you today by the end of my shift is to hear some bowel sounds moving, because if I don't, it's going to lead to more complications that I don't want you to encounter. So we're probably going to try to get the ball rolling, getting you up and walking, because that's going to help start that bowel movement.
Okay.
And since you are on NPO right now, which is pretty much nothing by mouth, so the doctor doesn't want you taking any liquids, any ice chips, anything like that. In order for that diet to get moved up to probably a clear liquid, we got to get here some bowel sounds. Okay, so that'll hopefully be a little motivator for you, because you probably are a little hungry.
I am.
Yeah. Okay, so anytime you need to use the restroom for bowels, let me know, because I want to make sure I assess that. Are you passing any gas? Probably not, since I didn't hear anything. Okay, so I want to know about that too, because those are going to be good signs. Let me go ahead and palpate real quick. So, how's that? A little tender on the incision. Anything here?
No.
Anything here?
No.
Okay. And have you gone to urinate yet?
Not yet.
Not yet? Okay. Well, what I want you to do is, there is a container in the toilet right now, so when you need to use the restroom, I want you to go ahead and let me know, because I want to make sure I assess your urine before you flush it down the toilet, because I want to
Okay.
make sure that I have an adequate amount. I want to see the color, any odor, and ask if you've had any burning or anything sensational with that, okay?
Okay.
So let me go ahead and remove my gloves. Wash my hands, put on new gloves. And then I'm gonna go ahead and just start off pretty much from your head down to your toes, and I'll let you know exactly what I'm doing as I'm doing it, okay?
Okay.
So we're done with your incision, so I'll put that there for now. So let me take out my pen light. So I'm gonna go ahead and just measure your pupils right now. So just look straight at me. Okay, about a 4. I'm gonna flash quick light on you, so just look at me or look at the pen light, it's fine. Excellent. Other side. Perfect. Go ahead and follow the light. Pen light, sorry. Okay. Real quick, have you had any recent headaches, nosebleeds, ringing in the ears?
No.
Any issues with speech or coordination, memory problems that you're concerned that you want to let me know about?
No, none of that.
No? Okay. Let me go ahead and just assess your head. You haven't been laying on it for a while, so I'm not
No.
too concerned about any ulcers, pressure ulcers forming, but checking your ears, your neck. Looks good, and your skin feels warm to the touch. Color is evenly distributed. Can you go ahead and smile for me? Show me your teeth. Puff out your cheeks. Raise your eyebrows. Go ahead and stick out your tongue and say ah. Excellent. Okay. So now I'm going to go ahead and just listen to your lungs and your heart, and I'll let you know when I need you to, I want you to keep breathing, but I'll let you know during each spot, okay?
Okay.
And then I'll do the vitals right after. Just move your hair real quick. I'm going to listen to your lungs, find the carina, and then listen to each side of the carina. Go ahead and just breathe deeply and out. Go one more time. One more time. Okay. One more time. One more time. Next one. Okay. And then go ahead and listen to your heart. Here's the aortic, your pulmonic, your herbs. If I heard any murmurs, I would hear it here. Tricuspid. I'd also assess the patient's respirations at this point, and I wouldn't let her know so I could see the rise and fall of the chest. And then mitral, which is the apex of the heart. Listen to it for 60 seconds. Okay. And then with your breathing, have you had any shortness of the breath during exertion or just sitting there that you feel like you have to catch your breath?
No.
Are you a smoker?
Not a smoker.
Do you take any oxygen at home?
I don't.
Any recent coughs?
No.
What about with your heart, any chest pain?
No.
Do you feel like your heart seems like irregular beats when you're doing certain activities, or are you pretty
Nope.
steady?
Yeah, pretty
Steady?
normal.
Okay. Let me go ahead and take your vitals just after I went ahead and heard your heart and everything sounded good there. I just want to go ahead and double check with this. Is there any reason why I cannot use this arm? I see your IV's on the other side, so I'm going to go ahead and slide this on. Go ahead and just rest your arm there. And then slide your finger. Feel it?
Mm-hmm.
temperature, just place this under your tongue. Okay. Now temperature, very good. And then BP is 106/72. Oxygen is 99, so that's very good. I'm going to go ahead and just continue on with your arms.
Okay.
So, do you feel any pain whatsoever as I go down on your arms?
No.
And I see skin color is evenly distributed. I don't see any open lesions, cuts, rashes, anything to be concerned about. Feeling for pulses. Very good, they're even. Skin turgor, don't see anything. Temperature feels good to the touch. And do cap refill. Excellent. Can you go ahead and put your arms up like this?
Mm-hmm.
Can you go ahead and resist me pulling you? Push up against me. Fingers crossed. Can you go ahead and squeeze my fingers crossed? Excellent. Go ahead and put your arms out like this. Palms up. Close your eyes. I'm going to count for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Go ahead and open your eyes. Now pretty much what I did on your arms, I'm going to go ahead and just do the same thing on your legs. Do you feel any pain whatsoever?
No.
No. And skin color is evenly distributed. I don't see any open lesions, cuts, rashes. Let me go ahead and remove your sock real quick. I'm just going to check out your toes. Okay. Cap refill. Looks good. Next one. Looks good. Actually gonna leave it a little lower just to feel for pulses. There we go. Go ahead and put that on. Can you go ahead and point your toes towards the head? And then push up against my hands. Okay. And then go ahead and raise your leg. And then raise your other one. Okay. And how is your walking prior to your surgery?
Good.
Is it steady? Do you feel uncoordinated?
No, none of that.
Nothing? So that's good. How's your support system at home?
Good. My husband is going to be helping me.
Okay, so I just wanted to double check on that because I want to make sure that you have somebody, since you are a little, can't move a lot, so I don't want you doing any strenuous activities, okay? Lastly, I want you to go ahead and see if you can roll over to that side. I want to go ahead and listen to the back of your lungs and then assess your back side. Just take your time. I don't want you to hurt yourself. So check 1. Go ahead and breathe in deeply and exhale. 3, 4, 5, 6, then 7, 8, 9, and 10. Then go ahead and stay like that real quick. I'm going to go ahead and just assess for any pressure ulcers. Skin looks good. Don't see anything. Heels look good as well. Okay, go ahead and roll back. So I'm all finished now with my assessment. Just some quick reminders I want to let you know about. Main thing is the bowel movements. Okay, that's my main concern. So I'm going to be assessing that periodically. As soon as I start hearing that, we're going to up your diet so we can get the ball rolling with that so you can start eating. If you need to urinate, let us know. So cowbell's going to be your best friend with that one. Wound infection, I already told you the ones that I want you to let me know about if you see, you know, inflammation, any more reddening or any more pain. Other than what you're already feeling now, any outbreaks, any breakthrough pain, let me know about that because I want to make sure that pain medication is going to be working for you, okay? So again, let me know if you need anything. And then again, I'll be periodically coming in, okay?
Okay.
So let me go ahead and lower the bag.
Thank you.
And you will be all good to go. Thank you.